A very good evening, Transformative Today viewers, audience, followers, and readers. It's a wonderful Saturday evening, and it is my pleasure to have such eminent speakers on board with us today. Uh, Welcome, Dr. Ankur Garg and Dr. Gaurav Gupta, for giving your valuable time for this interesting, panel discussion that we are having today. The topic that we have taken today is hepatitis know-how for a healthy liver. Now, hepatitis is something, as viewers, as readers, me as a consulting editor, we all feel एक कोई वायरस है जो लिवर पर अटैक करता है और वो लिवर को डैमेज कर देता है. But is hepatitis this much, or is hepatitis beyond the Google definition that Google shows to you? Who am I to tell you? We have Dr. Ankur Garg, head HPB surgery, liver transplant, Nanavati Super Speciality Hospital. We have Dr. Gaurav Gupta, chief surgeon, liver transplant and HPB surgery, Fortis Hospital, Mulund, Mumbai. What a pleasure to welcome Dr. Ankur Garg and Dr. Gaurav Gupta. Thank you for coming and joining Transformative today live panel discussion. So, a very simple question I will start with. Hepatitis kya hai, doctor, and how simply can you explain it to our readers? Over to you, Dr. Ankur Garg.
So, Dr. Supriya, hepatitis is a broad term. Hepatitis, when we say hepatitis, it just means that there is some injury to liver. Not necessarily by the virus. It can be because of alcohol, it can be because of drugs, it can be because of diabetes, overweight, and a lot of other things, a lot of genetic problems. So, hepatitis per se means that there is some injury which is happening to the liver, for which the causes can be numerous. So, hepatitis just does not mean a viral hepatitis, which we commonly read across. Hepatitis B, C, or A, it can be due to anything. So there are different, a long list or long table of hepatitis. If we have to go through, for half an hour, we can just keep on turning the pages. But these all can cause.
I'm 100% sure. Dr. Gaurav Gupta, what would you like to add here?
Yeah, sure. Good evening, Supriya, and thanks for giving this wonderful topic for discussion. So, as Dr. Ankur rightly said, hepatitis just basically just the inflammation or injury to the liver, and the most commonly the in general people what they hepatitis means viral hepatitis. So they once they say hepatitis हो गया है, jaundice हो गया है. In Maharashtra, they say COVID ho gaya. So basically, what they mean is just viral hepatitis. And basically, viral hepatitis are most commonly the 5 types: A, B, C, D, and E. So these 5 are the viral types of viral hepatitis. Each have different. All these hepatitis have different etiology, different how they behave, the life cycle, and some of them are acute, some of them are chronic. So each have how we get infected from this is different. How we treat them is all different.
That's a very interesting point, Dr. Gupta. You just mentioned that how we treat them. It all depends on that. In general, of course, the awareness is towards that this is something which is going to damage liver. So when it comes to hepatitis, Dr. Garg and Dr. Gupta, has it got anything in terms of, is it something genetic? Now, this is a lot of people get confused. There is a lot of confusion and miscommunication about it. Also, the fact that some people feel that hepatitis vaccine nahi liya isliye hepatitis ho gaya. Of course, so these are the things which, as experts, if you can throw some light on that. Yeah, over to you.
Yeah, hepatitis being genetic are very rare causes. Of course, the newborns and the young age population, children of small age will be affected. But primarily, just labeling hepatitis as a genetic disorder is not something very common which we come across, treating patients or across a medical disorder. Vaccine nahi liya hepatitis is, vaccine is there only for hepatitis B and for hepatitis A. Like as Dr. Gaurav has already told, there are 5 kinds of viruses which cause hepatitis. Out of them, the vaccine is available for A and B. For B, of course, it is a very effective vaccine and it is a part of a immunization protocol now. So every newborn baby is being immunized with hepatitis B. As far as hepatitis C is concerned, there is no vaccine for it. Hepatitis E, there is no vaccine for it. And as I told you earlier, if you see in a common day-to-day practice, alcoholic hepatitis almost forms 40 to 50% of the total caseload of hepatitis. So if there are 100 patients of hepatitis in a society, as of today, roughly 35 to 40% will be alcohol related. Another 5 to 10% will be drug induced, common medicines used which can cause hepatitis or drug reactions. So it is not only that vaccine is something which can prevent against hepatitis. Vaccine is something which can prevent only against hepatitis B and not overall as such.
So, is there any research going on, and do you feel that these are the only two which have been deadly and not much research has been done on other hepatitis? What would you like to say, Dr. Gupta?
So just to add, so to your question about the hereditary or genetic, I mean, only one thing which we just to add to what Dr. Ankur says, one thing I want to add is, so especially hepatitis B is a disease which can transmit from mother to child. So if mother has hepatitis B, so she can transmit that hepatitis in utero, and the child may have hepatitis B. With hepatitis C, it is much less, but with hepatitis B, is much more common. And in India, in our part of the country, hepatitis B is kind of an endemic. We don't have much hepatitis C. As coming to your question about the research, as far as I know, hepatitis C, I don't think so. There is any vaccine coming in near future. But the good thing which has happened for hepatitis C, again, hepatitis C is kind of a virus which gets transmitted through blood. So through blood transfusion, use of needles, infected needles, things like that. Now, the good thing which has happened in last 6-7 years is excellent treatment for hepatitis C, the tablets which have come, so which have actually revolutionized the how we treat the hepatitis C. There was a time when if someone gets hepatitis C, it's almost sure that he will remain with this disease for lifelong. Very few, like hardly 10-20% will get treatment, and that treatment was also expensive, prolonged injections, a lot of side effects. But this has changed since, I guess, 2012 and 13, and a very good treatment has come for hepatitis C.
So, somewhere, Doctor, I mean, the question is to both of you, Dr. Garg and Dr. Gupta. Somewhere, do you feel that in terms of awareness, it lacks some kind of social awareness? And what are the challenges like? Why the social awareness towards hepatitis has not been created yet?
So, I mean, I don't know, Ankur, you want to go ahead? I mean, I'll just say, I think the main thing is, so like hepatitis A and E, these are the viruses which spread through fecal-oral route. Basically, in common terms, eating street food, dirty, infected food, drinking water which is infected. So these are the problems which are more common in our part of the country as compared to the Western countries. Like because we not many people are getting. I won't say not many, but not everyone is getting like clean drinking water. So they don't get like tap water, which is being filtered from the municipality. So that's the
Right.
one reason that people in India are more prone for hepatitis A and E as compared to
Okay.
the Western countries. So that's again because we have more communicable disease. All the whole any kind of communicable disease is much more common in India. So that's kind of a reason. And I think the awareness includes mostly healthy lifestyle, like eating. I mean, not infected. I mean, good, clean drinking water, things like that. I mean, that is kind of a thing which will probably decrease the incidence of Hep A and Hep E in our country. I'm sure Dr. Ankur
Okay,
will like
so
to.
somewhere, I think the healthy lifestyle and the healthy eating habits seem to be playing a role in hepatitis as well. What would you like to say, डॉक्टर अंकुर? क्योंकि आज की डेट में जब से पेंडेमिक हुआ है, हर कोई बहुत ही हेल्दी लाइफस्टाइल और स्लो लाइफ पर आ गया है. Please share your views on this.
Yeah. See, as far as the liver health is concerned overall, of course, healthy lifestyle has got to play a role with if it comes to an individual organ, whether it is liver, kidneys, or heart. A healthy lifestyle will help in functioning all the organs very well. So is true for liver also. So there is nothing different that for liver we have to have a certain kind of lifestyle. a healthy lifestyle in general, in a broader perspective, is basically, a physical lifestyle and a dietary lifestyle. So if these both lifestyles are being taken care of, liver definitely remains healthy. Coming to hepatitis per se, as of today in the developing world, in the modern era, around 10 to 15% of the patients overall, the liver disease patients, 10 to 15% patients are something which we suffer from a common term called as fatty liver. And if it is not checked, it progresses to a stage of hepatitis, then it progresses to the stage of fibrosis and even leads to chronic liver disease and a failure. So 10 to 15% of the patients as of today, if you take the data of modern countries, they are undergoing liver transplant just because of fatty liver related problems. Whereas,
So would
10,
you like to explain, doctor, what is fatty liver? मतलब fatty liver generally public को क्या समझ में आना चाहिए इससे?
so general public should as simple as understand fatty liver means fat in the liver.
Fat in the
So
liver. Okay.
we all have some amount of fat in the liver. Up till 5, 10%, 15% is an acceptable limit, which we all have probably. Beyond this, as the percentage of fats keeps on increasing, so it keeps on hampering the function of liver cells. Because more and more part of the liver is being taken up by the fat. Fat is something which is not going to function, what a normal liver cell functions. So that is, for a layman, fatty liver is accumulation of fat in the liver. Beyond a certain limit, it will start affecting the function of the liver. So that is what
Very
fatty liver is.
interesting, doctor. I think quite an interesting interaction has started, and we are clearly getting some good feedback. Some readers are saying it's a good initiative that you have taken. Yes, it would be good to know what is fatty liver. Of course, I mean, I knew that this is how, in layman's language, it's really difficult to understand. Okay, coming to, we are talking about the status of liver here, doctor. So, has it got anything to do with men, women, and children per se? Today, in kids also, we have noticed certain liver complications. So, yeah. Dr. Gupta, would you like
Yeah,
to
sure.
talk about
So,
this?
so see, childhood obesity is a big problem. I mean, in today's time, and we see kids eating all kinds of junk food. I mean, once they start at very young age and they don't want to eat healthy food, I mean, it starts all kind of junk food. So childhood obesity is a big, big problem. And you might have heard some kids getting bariatric surgery now, which was like unthinkable probably like 10, 15 years ago. So that's a like our lifestyle. It plays a big role. Mostly we associate diabetes, hypertension, obesity with like heart problems. Okay, heart का problem आ जाएगा, heart stroke हो जाएगा. None of us till recently used to think कि कोई diabetes से, blood pressure से our liver can get affected. So, and this is as been mentioned earlier, that it is becoming one of the biggest challenge which we liver surgeons or liver physicians are facing. What we call is fatty liver leading to chronic liver disease or leading to chronic liver failure. So, I mean, especially, and this is more common in Indian males as compared to the females, because our heredity is like that. We are much more prone to get coronary disease. We are much more prone to Indian males are prone to get much more visceral fat. So, if you see a male with a big belly, so that's a recipe for disaster. He will have much more fat inside. So all his organs will be filled with fat as
So
compared to.
somewhere I think somewhere women have, they can actually relax and just sit quiet because this is something affecting more males than female. But also the fact that, again, the readers have been asking these kind of questions. Has it got anything to do with bad habits or, habits of heavy smoking or drinking? These are the common things that people relate liver damage with. मतलब
Correct.
liver का function खराब हो गया तो maybe आप बहुत स्मोक कर रहे हो या आपको
Yeah, we're
बहुत
not drinking.
ड्रिंकिंग है
Correct.
या
So as you rightly said, we see these patients daily in OPD with a patient coming with what we call cirrhosis or chronic liver disease. So मरीज patient will say, sir, मैंने तो life में कभी drink नहीं किया. I've never drink alcohol. I've never smoked. Still my liver is damaged. कैसे damage हो गया? Because as you rightly said, people associate liver disease only with their drinking. So they associate obesity or diabetes with heart. They will associate liver with drinking. So again, this has been mentioned again and again. So diabetes, overweight, hypertension, thyroid problems, what we call commonly called lifestyle disease, they do damage liver. So this is one thing which I think if from this talk, if we can give this message to general public, that will be the wonderful, because people associate कि इससे हमारा हाँ हार्ट खराब हो सकता है, एंजियो इन दे टेंड टू डू इको करा लेते हैं, एंजियो करा लेते हैं, बट we tend to ignore our liver, which is the one of, I would say, the workhorse of our body. And but these disease do damage our liver, and this is becoming like itself is a pandemic. If you ask me, NASH is a pandemic, and it's like almost half of our patients are NASH patients. I'm sure Dr. Ankur will agree to this. Ki we are seeing so many NASH patients. Just give me 2 seconds. So I'll tell you. Ki when I was in getting trained in US, so we were seeing so many NASH patients, which were kind of not that common. I was talking about 2008 and 9. In India, it was not that common. So I thought this is more of like a Western disease. But
Right.
I think it has changed a lot in last 10, 15 years. And even in India, we see much more incidence of fatty liver leading to NASH patients.
We have some interesting questions coming in, Doctor, wherein the readers are asking, what are the ways to keep our liver healthy? I'm sure this is something which is the a question with every reader's mind. मतलब इसके तरीके क्या हैं? चलो पता तो चल गया कि liver damage है. Also, here I would thanks to our dear reader. Here I would also like to ask Dr. Garg, are there any initial symptoms? Does hepatitis or does the liver damage give some initial symptoms, or does it come like a shock to the family or the dear ones of the patient?
So see, that's the one beautiful thing about the liver is that it is the only organ in the adult body which has a power to regenerate. Regenerate means it can heal on its own, it can grow on its own. And the other sad part, when it comes to treating patients or from a patient perspective, is that our body has got a very huge functional reserve of a liver. And anybody will have symptoms of liver only when more than 70-75% of the function is already gone. So people can be very normal and face hardly any symptoms even if they're 25 to 30% of the liver is functioning. So that is why to most of the people, if it comes to chronic liver failure, it generally comes as a shock to the family, because one fine day, they are diagnosed with chronic liver disease and they hear this for the first time that their liver is failed. So they come to a question that I have been going on a regular checkup, nobody ever told me, I didn't have any problems. But the sad part is, because somehow body was managing with this liver and it gave it, the capacity only when less than 25% was functioning. So yes, to a lot of people, it comes as a shock because symptoms of that gravity or that severity they set in only when majority of the liver function is already lost.
So, any solutions to this? I mean, is there any, like for diabetes, for sugar, we have something कि घर पे बैठ के आप थोड़ा सा check कर सकते हो. अभी जैसे आप oximeter के through अपना oxygen level check कर सकते हैं for COVID. So for this is a generic question. I'm sure this is there in readers' mind. So any suggestion or any tips here would you like to add?
There I will feel that any individual if they have any of the high risk factors, like if they are a regular alcohol intake, if they are diabetic, if they're overweight, they're obese, or their physical lifestyle is not very active, they should be aware of it that my liver might also get affected at some point in time. So for them, a more frequent follow-up or a more frequent checkup with a specialist, either a hepatologist or a liver transplant team will be beneficial. But otherwise, for a layman, if he does not has any of these risk factors, he has taken vaccine for hepatitis B, he's keeping a healthy lifestyle, I don't think so. We need something a very regular checkup for as far as liver health is concerned. But yes,
Interesting, Doctor. Okay, Dr. Gupta, would you like to add something here?
No, I think it's been rightly said. I mean, there's basically what you want to do is just things which are sound simple but are, I think, difficult to follow. Having healthy eating, healthy lifestyles. They sound so simple but difficult to follow. And
Simple and looks difficult to follow. I really don't know, but I think pandemic has taught us, the pandemic itself is a lesson. Now, coming to pandemic, Dr. Garg and Dr. Gupta, I have this question. Pandemic has clearly shown us, there has been a surge when it comes to liver damage. There has been a surge when it comes to liver surgeries. So, as readers and as viewers, do you think it has got any connect?
See, to be very honest, COVID per se, if you, though COVID is also a recent disease, a recent virus. So even the medical literature is limited about COVID. And not that the medical fraternity knows everything about COVID from A to Z. No, we don't know that. Though I'm not a COVID expert, but because it is a disease which have been in human population only for 1 year, so only that limited amount of study has been done on it. But
Right.
overall, my experience and whatever medical literature exists, COVID per se has got not led to any increase in the liver disease. But a COVID patient having a systemic manifestation, like, COVID infection has become so severe that it is affecting all the organs, so definitely liver will also get affected. But COVID per se affecting isolated liver conditions or something is
So not
generally.
not related, not linked. We shouldn't be linking it. What would you like to add, Dr. Gupta here?
So I think I agree. I mean, there I don't think so. There is any direct connection, but I'll tell you there might be some indirect connections. So I'll tell you. I saw a patient last week in my OPD. So patient was again alcoholic, and he was diagnosed with cirrhosis almost a year ago. He left drinking, and his liver was holding on. So he told basically his wife told me that since lockdown, because he was sitting at home, he again started drinking, and now his liver is gone to failure. So I don't know it's effect of pandemic or whatever, but I'm telling you the true story. It's not a joke. So,
That's
because he was sitting at home, he was not doing anything. He again he again goes went back to drinking, and there was hardly any liver reserve in him. And now he's
uh,
in what we call is acute alcoholic hepatitis. I mean, he's in almost in the liver failure now.
So we
So
have this interesting question coming up, Doctor. Since you're talking about the patient story, there is someone who is asking, please suggest a good nutritious diet for the patient. So probably there is a patient at home or somewhere, so they're asking for a good nutritious diet. Would you like to add something here,
all
or is
the
there
things
any nutritious diet? Yeah.
So all the things which does not taste well, which are not junk, they are all nutritious. So basically, green leafy vegetables, fresh fruits. So these are all contains what we call antioxidants, lot of vitamins, minerals. So these are all good for your liver. So you need to eat lot of green leafy vegetables, fresh fruits, even eggs, chickens. These are all good. The non-red meat is good for liver. So these are all good things which and avoid obviously between all of us are talking. Avoid fatty food, fried food, trans fat. All these things are
Absolutely.
not good, obviously, for your liver.
We'll come to the trans fat part here, but before that, we'll take this quick question here. Can we get to know in detail what is hepatitis B and how severely can it affect us? It's a very good question here. Obviously, we have been talking about hepatitis, but certainly the readers are curious to understand the different types of hepatitis. And yes, since we are talking about the symptoms, doctor, so do these different types of hepatitis show different kinds of symptoms?
See, hepatitis, because of any reason, whether it is a viral induced hepatitis or a drug induced hepatitis or a alcohol induced hepatitis, ultimately it is the liver function which is getting affected. So, more or less, the symptoms of the body will be remaining the same. Most of the patients with hepatitis will complain of some amount of nausea, vomiting, loss of appetite. In severe forms, they will complain of jaundice, dark colored urine. So, hepatitis symptoms will be, more or less the same, whatever the cause may be, because ultimately they relate to the loss of liver function. So, body will behave in the same way. So, whatever the reason for hepatitis may be, symptoms almost always remains the same. Coming to the question about hepatitis B, so it is one of the viral infections, out of the 5 viruses that we know in medical literature so far, they cause direct hepatitis. So hepatitis B is one of them. So it is very common in population, and it is a very infectious virus. It can even, get in a household. Generally, if one person is positive, it's very likely that his rest of the family members will be positive. It gets transmitted with saliva, with food sharing, and with close contacts. So generally, hepatitis B is a virus which will generally not cause anything acutely. Nobody will even come to know, that whether I got hepatitis B infection, barring less than 3 to 4% of the patients. Majority of the patients, this hepatitis B virus will keep on multiplying in the body, keep on damaging the liver gradually, gradually, gradually. And the first time when patient will have symptoms, it will be like 10 to 15 years or maybe 20 years after he got hepatitis B infection. And by the time, these patients, they come for, we diagnose their hepatitis B, the most of the damage is already done. As I earlier also told, because liver has got a very big reserve. So they don't show symptoms unless, 20, 70, 75
Unless
of
it's way too damaged, I guess. Yeah, this this clearly indicates that hepatitis certainly needs this kind of awareness towards hepatitis is a must. It looks like because the damage is not visible. I mean, it is definitely not visible because the symptoms are not symptoms are quite subtle, if I may say. So we have these interesting questions coming up, wherein again the diet is being asked. I'm sure the readers would definitely like to know more about diet. There is one good question here, which I would certainly like to show it to you, and if you would like to answer this, what is the total no in hepatitis disease? Like any food or drink or anything that you would say no, ये आपको बिल्कुल नहीं खाना चाहिए. अगर आप इसके liver damage हैं, अगर आप patient हैं, तो ये आपको totally avoid करना चाहिए.
So basically, I mean, so hepatitis, if you talk about, say, acute hepatitis. Okay, acute means it's, the symptoms are lasting for small, not a long duration. And generally, acute hepatitis, they recover. I'm talking about the viral hepatitis. So such patients, probably there is no restriction for food. So you can eat and drink anything what you want. But if you
barring
talk
alcohol.
about, sorry,
Barring alcohol.
yes, obviously. Yes.
I guess this
But
by now I think we are almost in half of the talk. So by now readers clearly know that doctors ने ये तो बिल्कुल no बोला ही है.
correct. So, and basically, if you talk about a patient who have a slow ongoing damage, what we call is chronic liver disease, or hepatitis happening because of that in hepatitis B and C. So those are the patients where we tell them to avoid food which has a lot of salt content. So these are the patients only where the liver has already gone into partial failure. They develop water in the belly, पैर सूज जाते हैं, pedal edema हो जाता है. So in ऐसे patients को हम बोलते हैं to avoid foods which have high salt content. So achar, chutney, bakery products, things like that, papad. So that is one thing. Second thing is the red meat. So red meat is supposed to be not good for the liver. So we tell them to avoid the red meat.
On a heavy fatty side, I guess. Yeah.
So like mutton, things like that. So red meat. So that's the one only thing. Otherwise, someone has acute hepatitis, they can eat everything. And we have discussed, main thing is if they eat good green leafy vegetables, fresh food, fruits.
A
Those are
balanced diet is, I
correct.
think, the key to everything. We have this another interesting question coming in. What are other liver diseases? Yes, this is something which क्या liver damage or liver diseases सब कुछ hepatitis से ही related है, doctor? This is something which readers certainly want to know.
See, I think, as I told initially, also hepatitis is a very broad term. Any damage to the liver, either because of a virus, either it is because of alcohol, or it is because of fatty liver, or sugar, or diabetes, we all club this as hepatitis. So, hepatitis is one spectrum of diseases where we say that the liver is getting injured because of some agent. Either that agent can be a virus agent, it can be a physical damage, it can be a chemical damage because of drugs. The question, what reader is trying to ask me, if I get it right, is that what are the other liver diseases?
Right, right.
Other liver diseases, if we see in medical practice, barring the hepatitis and the inflammation part of the liver, most of the patients with liver disease will come with some, they got their ultrasound done and there was some lesion in the liver, 1 centimeter, 2 centimeter, 3 centimeter. So that is how most of the patients will come. Either they will come with a blood report where their liver function test will be haywire. So that is to come into a category of generally hepatitis. The another category will come that their liver functions are absolutely normal, but they got their ultrasound done or a CT scan done for some other problem, and there is some problem with the liver, either a 1 centimeter, 2 centimeter lesion. So all that I can tell as a common man to understand is that liver is also a soil for most of the cancers. So most of the cancers, when they spread and when they become stage 4 cancers, liver is generally the first organ to get affected. So either it is breast cancer or uterine cancer, pancreatic cancer, liver is generally the first area where the deposits will go and happen. So most of the other problems other than hepatitis is what they come with, cancerous lesions of the liver.
So I'm flashing this question to your screen now. This is a common question which I was expecting the readers would be asking. Is liver transplant surgery expensive and how much? So I don't know how much if you would be comfortably talking about. But
A
yeah,
very
that is a common, I think that's a common myth or a, question, a query, a curiosity among readers that अगर आप पूरा ही डैमेज हो गया है तो क्या ट्रांसप्लांट इज द ओनली सॉल्यूशन लेफ्ट and if yes, then is it an expensive affair?
So,
see,
sorry. Go
Yeah,
ahead.
no, no,
Yeah, Dr. Gupta.
Sorry. I think to answer this question, is liver transplant expensive? I mean, it depends how you want to look at it. So a patient, so who needs a transplant? A patient who's gone into the chronic liver failure, what we call is chronic liver failure, where the liver is not working, it's almost 70-80% damage. पेशेंट को बार बार मुंह से खून की उल्टी हो सकती है, पेट में पानी हो सकता है, लिवर में कैंसर हो सकता है. So these are the patient who needs a liver transplant. Now you need to see expensive in the sense ki, so what options these patients have. So these patients have only two options. One is go for transplant, and second is you go for just say medical management. Now we have seen with medical management. First of all, the medical management is a symptomatic treatment. That means कि आपका it's not a cure. Medical management is trying to control your symptoms. कि जैसे मैं सबको एक एग्जांपल देता हूँ कि आपको मलेरिया है, तो मेडिकल मैनेजमेंट मतलब क्योर उसका है कुनीन है और सिम्टोमेटिक ट्रीटमेंट उसका क्रोसिन है. सो आप कुनीन लेना चाहोगे या क्रोसिन लेना चाहोगे? ऑब्वियसली कुनीन लेके आप ठीक होना चाहोगे, राइट? सो सेम थिंग गोज विद लिवर ट्रांसप्लांट एज मल्टीपल medical treatment.
I think you
Now,
have summed it up in a nice way by giving this example wherein, what would you like to go for? I'll quickly take this one more question before Dr. Garg adds further here. There is this question. I have a friend who went through liver transplant. He feels weak. I think the person is trying to say weak. मतलब उसको कमजोर feel हो रहा है शायद. Would you recommend something? I mean, is this something which the patients who go through transplant, do they experience something like this? This is what I would certainly like to know. And what are as a family, as a friend, what they should be, the near and dear ones should be doing? Yeah, Dr. Garg.
so after liver transplant, barring the initial 1 or 2 months, that is the phase of recovery of a patient, most of the patients they will regain their health normal as per their age, depending whether they were 40 years old or 60-year-old. And on the contrary, most of the patients after liver transplant will gain on an average 10 to 15 kgs of weight within a 3 to 4 months of span of time. So liver transplant patients after transplant, they don't feel weak, they feel energetic, they're back to work, they feel younger by 5-10 years of age. 6 of my patients are already, BSF patients when I was in Delhi. They are posted back on their borders. And most of the patients will go back to their work. Even a lot of,
Wow.
Mumbai police constables or Delhi police, they have undergone liver transplant and they are back on street jobs and duties. They don't feel weak. In fact, when a liver disease patient comes to that stage, where he requires transplant, all his muscle and protein is already lost. So after transplant, they require 2 to 3 months of time to regain that kind of nutrition. But after 3 months, they are good to run a full marathon. They are even more fitter than us.
I think any surgery requires that much of that much of period of rest. Also, the fact I think when it comes to surgery, the moment you think of a surgery, उसी time आपको एक डर तो वैसे ही हो जाता है. So probably that is one of the reasons why people are that weakness. I think that panic probably leads to some kind of weakness. What an interesting session! What an interesting live is going on, and I'm readers are definitely getting benefited by this. Before we come towards the end of our discussion, I have one quick question to Dr. Gupta and Dr. Garg. There are many myths and facts around it. Facts का तो पता नहीं doctor, but myths तो definitely society में बहुत ज़्यादा हैं. any particular, you feel that there is misinformation which is already around on hepatitis, and which you would, Transformative is definitely a platform where if you can clear those doubts of the readers, of the general public.
So I don't know about other things, but I just want to mention one thing which I keep seeing in my patients. So as you said, there are myths. So the biggest myth which I see is so hepatitis or jaundice, what we say. So people think with some. So I don't. So first of all, I don't want to. I mean, kind of discredit anyone, but things like so जैसे बाबा लोग हम लोग ये जड़ी बूटी दे देते हैं, नॉट जड़ी बूटी, आई मीन आई शुड से जब ये दे देते हैं वो देते हैं, सो बेसिकली पीपल touts give lot of wrong things for this jaundice, and
Right.
we actually their liver is getting damaged by these things because a lot of these drugs contains heavy metals, mercury, lead, and they actually lead to even permanent liver damage. So one thing I would want to say, so I'm not saying I'm not against Ayurvedic treatment, I'm not against, but you should go to a trained doctor. Don't go to someone who is not does not have a degree. So go to a proper, if you want to go to Ayurvedic, go to a proper BAMS. You want to go to homeopathic, go to proper degree doctor. Don't go to someone who is just practicing medicine without any degrees and trying to flee people. And these are the people who are damaging people's liver. And so that's the one thing which I want to just convey to everyone.
What an interesting thing you added. I think the debate between homeopathy, allopathy, and Ayurveda will keep going on. It is something eternal. Okay,
No,
so Dr.
no,
Garg, over to you.
don't make it like I'm against these. I'm not
No, no,
against
no. I'm
these.
just saying it is something generic. Yeah, Dr. Garg, over to you.
Yeah, Dr. Supriya. So, coming to myths, I think the biggest myth that is there around in common public is when they have this hepatitis or what we call as jaundice. Virtually everybody in India, at some age in time, by 10, 15 or 20 years of age, they get one episode of hepatitis or jaundice. The biggest myth that floats in a common public is, in hepatitis, they don't give people to eat food. They put so many restrictions. Don't give oil, don't give butter, don't give yellow food, don't give yellow dal. There is nothing like this. I feel in hepatitis already there is so much loss of appetite. I think we should give the food what patient likes to eat at that point in time, because recovery of hepatitis will happen with time, but nutrition plays a very important role. So this is a common myth, which exists in my family, and most of my friends will ask. So there is nothing like this. These food items are not to be given during hepatitis or jaundice. I think the food which patient likes, and he will have a stomach full of that food. That is what should be given to the patient. That is what I always counsel.
What a good point you just shared. So, be it green, be it yellow, dal to dal hai, and if the patient is loving it, let the patient relish it as well. So, on this note, I would certainly like to end this wonderful discussion on hepatitis and healthy liver that Transformative initiated on this Saturday evening. Before we say bye to our readers, one last quick message from both Dr. Ankur Garg and Dr. Gaurav Gupta, who agreed to share their valuable information and spend time with Transformative Today readers. So, Dr. Ankur Garg, over to you. One last quick message.
One last good message is stay good, stay healthy, stay positive. It's the mantra of life.
It's the mantra of life. Stay good, stay healthy, stay positive, not COVID positive, of course. So, Dr. Gupta, over to you.
So I completely agree. I think we should eat healthy. We should, have a healthy lifestyles. And if you do that, that is the best thing which we can do for all our organs, not only the liver. So I think that's the only message. And not only physical fitness, our mental health is also very, very important for keeping ourselves fit.
And we have such motivational comments coming from our readers, and they're happy that diet, hepatitis, and awareness towards healthy liver has been emphasized. Thank you once again, and a very good weekend to all of you. Bye.
Thank you, Dr. Priya. Bye and good.